New tonight, the Centers for Disease Control and Prevention issued a health alert for Americans traveling internationally for spring break. This after 58 cases of measles have been reported in the U.S., including one in San Diego County, and the number is growing around the world. Good evening and thank you for joining us. I'm Carlo Cicchetto. Marcella Lee has the night off. Almost all of the cases were connected to travel outside of the U.S. The CDC has updated guidelines now recommending Americans check in with their doctors 6 weeks before international travel to confirm that they are up to date on their measles vaccines. CBS 8's Abby Black has more on how to stay safe if you plan on taking a trip abroad.
Children across the world are affected by the measles outbreak. And before you take off this spring break, whether it be within the state, across the country, or internationally, doctors at Rady Children's Hospital want to make sure that children are vaccinated against the measles.
58 measles cases in the U.S. this year. That's the same amount for all of 2023.
The main thing with measles is that it's really contagious. So if somebody goes into a room with 100 people and they're not immune to measles, 90 of those people will get measles.
Dr. Edmund Milder is a pediatric infectious disease specialist at Rady Children's Hospital in UC San Diego. Last month, San Diego County faced its first and only reported measles case this year. It involved a 1-year-old girl who traveled internationally and brought the airborne virus back to the U.S.
Anywhere you gather and have a lot of people, you're just going to increase your risk, especially with measles, where you don't have to be, within that 3 to 6 feet to get exposed because it can travel through the air.
Today, the CDC issued a health advisory on travel after an increase in global and domestic measles cases. The CDC reports that 58 measles cases are in 17 states and 93% are linked to international travel, and most are children 1 year and older who are not vaccinated. They encourage children 6 months and older to be current on their measles, mumps, and rubella or MMR vaccine.
People get a cough, congestion, red eyes, conjunctivitis, and then fever. And eventually they'll get a rash that usually starts on the face, behind the ears, and then spreads down the rest of the body.
Measles was eliminated in the U.S. in 2000. Then in 2014, Disneyland had an outbreak, and 5 years later, there were 207,000 deaths worldwide, which was the worst outbreak since 1992.
Most kids will then be able to fight it off and make a recovery, but the risk is that some kids could have inflammation of their brain and some kids can die from the infection.
California has strict vaccine exemption laws, and the MMR vaccine is required to attend public schools. Still, nationwide vaccine rates have dropped since COVID. Before you take off by air or car this spring, Dr. Milder says make sure that you're updated on your vaccines to protect those who can't get vaccinated, which are babies younger than 6 months and immunocompromised.
We can protect them by all the rest of us staying immune and not allowing the virus to spread.
Abby Black, CBS 8.